Baseball and softball are our sports in our family. We look forward to Jonathan and the team just playing and having fun, and we get into it as well when they strike out or when they get a good hit. Where we were at, it was sunny. We just saw the lightning at a distance, a far distance, and the umpire suspended the game. And we thought for sure in a half an hour we were just going to be back on the field playing again. Plow and Jonathan wanted to continue to throw the ball around, and I heard Jonathan say to the coach, don't worry, Coach, we'll be all right. And I just found that a little odd because I was thinking, you know, why wouldn't you be all right? It's just a very, very loud boom. I mean, it probably the loudest I've ever heard. And I saw the coach jumping up and down and saying, and he turned around and started running to the field. When I saw him do that, I knew Jonathan was out there and Clow was out there, so I started running, and that's when I saw both of them just laying there.
And I heard someone say, "We've got 2 down over here." He was completely lifeless. I checked his pulse and checked for breathing and determined that he was in full arrest, and immediately started CPR.
911, what is the address of your...
We have a lightning strike here at the baseball field off of in Massaponax. Lee Hill baseball field. There are 2 kids struck by lightning.
Were struck. Are they breathing?
No, they're doing CPR right now.
It was remarkable for Maria she's an emergency room nurse, so for her just to take charge and you know, start the CPR.
Her focus was incredible, and you could see she really had her composure in doing what she had to do. People kept saying to her, "Let's get him in a vehicle, let's get him in a vehicle." And she never wanted to stop that CPR until the emergency people arrived.
We had no change in this child's condition. He continued to be apneic and he continued to be pulseless, and we were beginning to think that our efforts were futile.
Because he wasn't breathing when we left, I just didn't know. I was praying that they were going to be able to bring him back, but I didn't know for sure. All our kids are special, and I just didn't want to see our life without our family being complete, you know, without Jonathan being a part of it.
You never know what's coming, and when it comes, you have to be ready. Our trauma base is very well equipped that I didn't have to prepare anything. In my mind, hearing the history, I had to make sure that I knew everything that I had to know to take care of him. We were ready in a few minutes. Initially, we were worried about the heart and the lungs. Does he have a heart rate, and what kind of rhythm, and how is his lungs? Is he oxygenating okay? To keep him alive through the initial moments, that's what we were concerned about. We also need a chest x-ray and a head CT.
At the time, he was intubated, paralyzed, and sedated, so we didn't know what his neurological status was at the time, which is very typical for a patient who's intubated. We have the capability within minutes of coming in the trauma room, should they look at his scans or determine that he has decompensated during the transport, we could take him literally within minutes to the operating room.
Oh, look at that.
He had some other subtle injuries, potentially exit wounds from the lightning coming through.
We could see the lightning entrance site and an exit site.
You worry about the what it did to his heart, his lungs, you know, how hypoxic was he, you know, what repercussions he's going to have from that. For Jonathan, his family was allowed to be in the trauma room at the bedside. We firmly believe in that, even in this detrimental situation. I mean, he potentially could have coded again. We still allowed them to be at the bedside with the support of the social worker and the chaplain so they could see what we were doing to their child, so they knew that we were doing everything humanly possible to save his life.
When a family comes in a crisis, my immediate intention is to find out, do they have, someplace to stay? Are there other kids taken care of? And do they understand everything that's going on medically? And how are they emotionally coping with what's going on? It was an extremely traumatic, dramatic situation.
When I first met Jonathan and his family, he was in critical condition. He was intubated. He was very sick.
Our primary concern when he came in was that obviously he had a cardiac arrest, and we were sort of treating him for that.
We thought he survived the cardiac arrest, and we thought maybe he'll do well, but we were still worried. And then when he started having pressure on the brain, we didn't know what kind of damage was happening, and it was touch and go.
We spoke with our neurosurgeons, and they were able to place a monitor inside of his head to measure the pressure inside of his head. As soon as we recognized that the pressure was elevated and was staying elevated, we have a protocol here for brain injured patients that involves cooling them and keeping them sedated, medically paralyzed, and sort of take the body out of the picture for a few days.
We lower their metabolic rate. We do anything we can to relieve the pressure in their brain.
Just simply an injury that leads to swelling starts to close off not the major vessels, but small capillaries. And you actually set a cascade into place where that injury leads to necrosis or death of small parts of the brain, in this instance the cerebellum. That produces further swelling that leads to clamping off of other vessels, and it can get into a very vicious cycle.
So on this image we can see how swollen the cerebellum is, and the cerebellum is exerting a lot of pressure. In fact, the normal contour of the brain is lost because it's basically sort of plastered up against this bone here, which is called the clivus.
The doctor will say, don't let his ICP go above 20, and then when it does, you have to turn, it's like a release valve, and let it drain the CSF, and then you turn it back and see if it's coming down. But then I guess he had kept getting more and more pressure on his brain, so we were having to turn that release more and more through the night. And I think it was at least every hour we were doing that, and also giving him medicine to help relieve that pressure.
It was rough. I mean, just because you think you're there and he's recovering, and then all of a sudden you're taking another step back.
We have to really meet families where they are and slowly walk down the journey with them and not expect them to be where we need them to be on our time schedule. And so for a family like Jonathan's, it was really just, do you need anything? And maybe a few times in the morning, a few times in the afternoon, and just slowly build some trust.
They kept coming in talking to us and informing us and keeping us up to speed with everything they were doing.
I think it had gotten to a critical stage of the game. So if you were to wait, then you risk. I think you have a high risk of herniation. And, there will be irreversible neurologic deficits.
The neurosurgeons had to do what's called a posterior decompression, where they open up the skull and let that area swell. It not only keeps the brainstem from suffering a critical or life-ending injury, but it actually helps ameliorate or lessen some of the damage to the cerebellum, because it can swell now in a non-confined space.
So this is the bone of the posterior fossa around the cerebellum prior to surgery, and then this is the area that we resected.
When you take a bone flap off as the skull, you give the brain a little bit more pressure a little more area to expand. So the numbers that we were looking at, like his ICPs were high, he was having some pupil changes, those things went away because the brain was able to expand.
When we deal with trauma, it's like, well, there's a major injury to a limb. We were like, well, we already start planning how will we get past that if it's a longer-term disability. But neurological injury, particularly central nervous system injury, gets to us, to who we are. Will he be the Jonathan before? Will it be somebody else? Or how will we deal with if he seems less of who he is? So it threatens that sense of us. And that's what makes it so potentially just catastrophic and hard for families.
You know, even when kids aren't awake and they're not talking and we don't exactly know how much they're aware, we know they can feel love and we know they can sense when the right people are around them. And so that's why we always want family to be around, so that kids know that that's their family. They haven't left them. They're still here, even if they can't interact the way they might normally do.
They were such a good couple. They really were very strong, and they were helpful to each other, which was, they made sure that each one was taken care of, and they would take breaks. So one would go and the other would come in. They never left him.
He didn't do anything for a while. You know, we were a little concerned. We didn't get any reaction to pain or spontaneous movement or purposeful movement, as we would say. It took a couple of days, but then...
First biggest milestones were when they were trying to decide whether Jonathan could actually think, what his brain function was, and what was voluntary movement and involuntary movement.
Him and his dad had this secret handshake.
Jonathan and I had a secret handshake. So I took Jonathan by the hand, and we actually went through the handshake.
He just did it, and I was like, I need to see. You know, can you show me? So, and he did. And he wasn't even like doing anything else at that point.
He was there. He could hear us. He was there.
They cried. I think everybody cried. I cried, that's for sure. Once he woke up, like, that was it. I think the ball just started rolling.
It's easy to pick up weakness, it can be easy to pick up verbal problems, communication problems, but sometimes the subtle cognitive problems are some of the most challenging things that we might see with a lightning strike. And certainly medically he was making some good improvement. He was ready to make that next transition to rehabilitation. We wanted to get him to an intensive therapy program so we could kind of work on starting off with some of the basics, getting where he could dress himself, bathe himself, get up and walk around in the unit, making sure we could work on his communication, start working on talking, certainly assess his vision, make sure he can interact with the environment.
It's actually the newer tech imaging and the state-of-the-art neurophysiology that at least told us this is somebody who can do well. And we supported him, and he cured himself after that. What we were able to supply is the support necessary for him to recover.
I'm just thankful that they kept trying to do one additional step. Considering where he was 2 years ago and where he's at now, I think he's doing remarkably well.
And thanks to all my awesome team of doctors, because if you would not have made the decisions that you did, I might not be here today. Since I was in the hospital, I've had support from my friends and people I don't even know.
I think he was determined to live. There's nothing that we have done differently. Every time I see a patient like this, I'm humbled. And that's what makes me work in the ER environment and in the ICU environment, that I'm able to see a patient from the beginning until the end, and that gives me a lot of satisfaction.
It takes a lot of communication and collaboration between everybody. I mean, you know, parents to nurses to physical therapy to doctors to everybody. I mean, you have to constantly be communicating with each other, because if you just miss one small thing, like the handshake, that was a big moment. Like, if I hadn't seen it, if the parents wouldn't have told me, we would have not known for a couple more days that Jonathan was coming around.
It's wonderful to be able to see the Colsons, you know, when they pop up here or there, and they have made such an effort to keep in touch with us, for us to remember what we are more than capable of doing, which is saving lives for kids who had incredible, you know, tragedies.
That's why we work here. That's why I work here. That's the miracles that happen.
To be able to have him to come up to us and give us a hug still, to tell me that, you know, I mean, he tells me I have a lot of gray hair. That's something I wouldn't have been able to hear if he wasn't here. Just his smile, his attitude towards life, just to know that we've been blessed and we didn't have to go through that part of our lives without him.
I can't express the gratitude to them enough for their devotion and what they did with unwavering confidence in telling us step by step. Their words cannot describe. I think about them every day.